Welcome to Woman Talk, where we keep it real. My name is Tara. Please join me and my girls Dee Dee and Promesta as we have difficult and informative conversations. Our goal is to uplift and encourage you. Please go with us on this journey.
We welcome you to Woman Talk, where we keep it real. You already know. I don't even think we have to say our names, do we? Because they should already know. But I'm with my girl Tara and Deandra, and we are here to talk about, this month is the mental health awareness. So we're just going to be talking about some things, just keeping it real like we do. You don't have to suffer in silence. So without further ado, let's just get right into it. So what do you got for us, Tara? Being that, this is the field that you work in. I mean, I'm sure that when it's, the mental health, awareness month, you guys get a lot more, I don't know, like maybe more people coming out to you, reaching out to you, things like that, or?
I don't think that we get more people. I just think that it brings more awareness. And I think this it's important because in the Black and Brown community, therapy and all of that stuff is still kind of taboo, except for millennials. Millennials be like, look, I'm going to see a therapist. I don't care. It's like part of their regular maintenance. But those of us who are older, we, they still struggle in that area. So I just think it's important that when we have these types of focuses, that we also bring awareness, because it's so important that people really look at their mental health as a part of their regular maintenance. They'll work out, they'll start eating right, but they'll still be mean as what, and depressed or whatever, but they'll work on this outside package and they'll neglect what's really going on the inside. So
I'm glad that you said that, because the fact that you said something about eating, and I know a lot of that. I know for me, the eating, whether you're stressed, you stress eat. When you're stressed, you don't eat. And then when you do eat, what are we eating? So maybe can we just kind of talk about the fact that, what we do eat affects our mental health, affects our health in general, like mentally, like we're eating something and it's like not healthy for us physically. And then physically we feel worse about our body, or we're tired, or we're sluggish. And then how then mentally we become depressed, and it just kind of all goes in together somehow, some way. How do they say it, that it starts in the gut? Is that do you ever talk about that, or those issues of how it all kind of?
Yeah, nutrition is important, but I think it's more from the standpoint of the association. So when you hear people, everything in moderation, but we associate good things with eating. So when we have a party, what are we doing? We're eating. We associate bad things with eating. When somebody dies, what we do? We gather to eat. So it's just there's an association between food and comfort, and because of that, in the Black and Brown communities, we have the issues that we have, because that's how we've been kind of associated to it, if that makes sense. Because food is not bad, right? We need food to be able to survive, but it's our relationship to food that we have to really take notice of.
So Tara, what would you say, just in your field? I know one of the things that I never knew that I was suffering from, but anxiety is really bad for me. And so what are like some of the things that you would say that are holistic that you think is also good for? I mean, we know that if people need medicine, if a doctor or somebody feels like, a professional feels like they need it, or, they agree, they come to an agreement that they're going to do that, they can do that. But do you have any holistic ideals of what people can do, breathing techniques, different things like that?
And move your body. That's what we really need to be doing. Look, well, I'm being honest. That's what we need to do. We need to get up and move. We need to get things circulating. And I know for me, I started working out again maybe a couple months ago, and it's been one of the best decisions. And not only do you start to look better, but you definitely feel better. There's different kind of chemicals and all of that are released in the body when you work out. And so that's the main thing. Breathing. So what you're talking about is, in the field, we call it mindfulness technique. So you'll see people getting into yoga, which focuses a lot on your breath things like that. That's really important, but also just for stress relief, because you get in tune with your your body. And it's something that I teach even little kids to do. I call it progressive relaxation. We're not going to go through the whole thing, of course, on here, but we start from the feet up slowly. And I teach them how to just slowly relax their body inch by inch. And that works wonders, especially for kids who are dealing with different levels of anxiety or trauma.
I know that you mentioned something about like breathing. You know, they say how you're supposed to do it. You're supposed to make sure that you're breathing correct. Because when we get like anxiety, we stop breathing, or our breathing is off, and then we realize then next thing you know, you're hyperventilating. You know, and you know, for all of our listeners, all of our watchers, you know, those who are watching or tuning in, you know, we all come from a different background. We have, you know, we have differences of opinions, you know, sometimes, but that's what makes us great. And one thing that I used to do, and I'm just going to put this out there, I no longer practice yoga for my own beliefs and my own, you know, coming from, I'm just going to say my own beliefs. I do think that stretching and exercising, you know, things like that is great. It's important. We need to do that. But as a disclaimer, I just, you know, want to put that out there. And that too, that what people believe in, whether it's religion or non-religion, plays a factor as well sometimes in our mental health, because sometimes we're drilled to believe a certain way, even when we're raised, you know, we're drilled to believe certain things in our upbringing, like counseling. People, you know, from, you know, who are, you know, older, they didn't really believe, in my opinion, about, you know, going to therapy or going to counseling. And I was drilled that way growing up, like what happens in our house stays in our house. You know, so there's things that we grow up as well, kind of being taught. And like the whole mental health thing is so important. The therapy, the counseling is so important. And sometimes for the younger kids, it's it can be hard and a struggle, because they grow up with that, you know, hearing, you know, maybe other adults in their family or those who are older than them, oh, you don't need counseling, you don't need therapy. But I just really want to stress that sometimes therapy is needed, and it's needed in a way that others may not encourage you to have counseling or to get counseling. But really listen to yourself. Like if you know deep inside you need counseling, you need to talk, you need therapy, and somebody keeps telling you, oh, ain't nothing wrong with you, you ain't got to go talk to nobody, why, you know, just listen to, you know, I don't know, how can we explain that more, Tara, about like that portion of nobody can tell me how I feel because I know how I feel. You know, Deandra, you spoke about that before, you know, well, we've, you know, addressed things like that before, but something very small to somebody else might be a trigger to us. So for somebody to tell us, what's wrong with you? You don't have to get counseling, or how can you encourage or speak to somebody that is thinking that way or feeling that way?
So what I usually tell people is this: I'm not into mental illness, I'm into mental health. And look at it like a maintenance. So we don't question when we go to the doctor. You have to get a physical once a year. It's just good medical practice. It's the same thing when you believe something is going on with your mental health. So the issue is this. Again, it's the association. We associate counseling or therapy with something that is negative. Something is wrong with you. Something's going on with your mind. When the reality is pain is a symbol or a sign that something is wrong, right?
Right.
When you have pain, it's natural to try to get that pain resolved. It's the same thing with mental pain and emotional pain. It's natural to want to get that resolved. So think of it like that. If you're going to counseling, it's because you're going for resolution. So instead of something being wrong with you, something is very right with you, because you notice that there's an issue and you want to get it taken care of.
Yeah.
I mean, is that a better way to say it? Y'all tell me. That's usually how I explain it.
I think it's a good way. I know with me, I usually try, because one of the things is when you have those triggers, I've tried to learn how to function through those, which I do through breathing techniques. I take a minute.
Yeah.
If I feel like I've been triggered or I'm put in a position where I don't like it and I'm uncomfortable with it, I take a minute and start doing breathing techniques before I actually respond. And then I think we just said something. I had someone tell me that anxiety was the devil. And I was like, all righty then.
Look, I'm not laughing because, okay.
I think we talked about this. Did I tell you about that? They told me that anxiety was the devil. That's for real what I was told.
I'm laughing because, again, that's a Black and brown people thing. And that's what keeps a lot of us bound. If I break my arm, you gonna tell me that's the devil, or you gonna tell me to go to the doctor? You're gonna tell me to go to the doctor.
Right.
If I'm struggling with my mental health or my emotional health, why not suggest that people go to the doctor? I'm not saying you don't suggest that they pray too, but go to the doctor. It's important. Right. Go see a therapist, talk to somebody, knock it off. And a lot of them, nobody wants to do the weirdness. Some people, when you gotta shop for a therapist, just like you shop for your doctor.
Yes,
absolutely.
I know I'm not everybody's therapist. I know that. I know
you're mine.
Jim over here like, well, you my therapist, so it's okay if you're not theirs, because I need your time, you know. But that's speed dial, girl.
Right, but that's what I'm talking about, because I had someone tell me this before. I had a girl tell me, everybody ain't good with that in your face, hard stuff that you do. Okay, then I'm just not the therapist for you. Because if you come to see me, you probably gonna get some in your face, hard stuff that you need to deal with. It's just the reality. Yeah. But some people need somebody to, you know, coddle them and hug them up and all of that. Okay, but I'm about being serious about your life. If you're serious about your life, I'm serious about your life. We don't have a lot of time for me to rub your back and coddle you and all of that while we're in session. It's things we got to take care of.
Correct.
So, and there's something that I wanted to bring up, because I know some people have asked me before, what types of disorders do I see the most? And, you know, most people would think, oh, anxiety, oh, depression, oh, this. And because I specialize in trauma, of course, I see a lot of PTSD. But what I see the most of, especially with young professionals, is just adjustment disorder, which to give a very general, simplistic overview, means I'm going through something. And if I wasn't going through this, I wouldn't be having this issue. It's really that simple. So it's young people getting into the profession. Young people going, well, dang, I thought I really wanted to be a doctor when I grew up, and now I'm a doctor and I don't like this field. How can I manage through that? Or, you know, that kind of thing. So if someone was to ask me, that's the biggest thing. It's just they're dealing with adjusting to how life changes.
Do you think that well, in your, you know, professional opinion, the adjustment of going into the field is because a lot of these or, you know, some of the younger men and women are very isolated. They're very like gamers, you know, they're a lot into the gaming and a lot into the, you know, just staying home and doing things from home, because I know I'm speaking, you know, let's say, for example, my daughter, you know, so she likes to stay home. She likes to do things at home. And so when she goes to work, then all of a sudden she's like surrounded, you know, she works in a store. So she's surrounded by like all these people, and people are, you know, with complaints and, you know, all this stuff. So what would you say to that, you know, younger person going into whether it's into an office or, you know, just going into the workforce, if they're not seeing a therapist, how can they adjust to that? If they're, you know, then, and then the fact that, you know, COVID, and then they were home, and then all of a sudden, like from being home and not talking to anybody, now, okay, go, like, you're supposed to go to work, you're supposed to do that. Like, how would you, you know, say what's best for them to be able to adjust to that type of a, you know, transition.
You just have to do it. No, seriously, you just have to do it. The other piece of it is remembering to take care of yourself through the process, because this has been a change for everyone. You guys have heard me say, COVID has been a change for everyone. It's more anxiety, it's more depression. People who never had any kind of mental health issue before maybe started having one dealing with the pandemic. So just know that any reaction you have is probably a normal reaction, and that's okay. So just give yourself more grace. Make sure you're taking care of yourself. Take time for yourself. Ease into it. I wouldn't say if you haven't worked and you're a young person just turning 17, 18, that you jump into a full-time job. I wouldn't suggest that. That's it. Just be kind to yourself. Give yourself some grace. Make sure you're taking care of yourself. Make sure that you're verbalizing. Make sure that you're learning how to socialize again, because that's important. So it's just all these things. It's almost like when somebody has to go through physical therapy to get themselves back on track, some things you have to learn how to do all over again. It's the same thing with us coming up out this pandemic. We got to learn how to socialize. Do we hug? Do we not? Do we shake folks' hands? Do we not?
Right.
All these different kinds of things that we have to learn how to do.
Okay, so what is it that they, I mean, I don't know if this is what you do, but a lot of therapists that I've heard, or, you know, they say, well, I feel this when do you use that or how, because then I've also heard it flipped by, you know, when people are, you know, in my opinion, can be very narcissistic, you know, and then they say, well, I can't make you feel a certain way, or why do you feel that way if I said this? Like, what do you do? How can a person really try to verbalize what they feel without, I mean, I guess, how do they start the conversation without saying that it's the other person's fault that they feel this way?
Sometimes it is the other person's fault.
But to give them that power to, like, how, you know how they say, well, I can't make you feel a certain way. But I mean, I do feel a certain way if somebody does something.
That's gaslighting and foolishness. What it is this. I always tell, if you're looking at yourself sometimes, and I say this, give yourself permission to be the most important part of the equation. You have to do that. So how they feel, what they say is not as important as you being able to express yourself. And and I say this, if somebody loves you, especially if we're talking relationship talk, but I don't care what type of relationship, parent to child, child to child, you know, romantic relationship, friendship relationship, it doesn't matter. If somebody truly cares about you and loves you, you can express to them what you need from them, and they respond out of the love they have for you, not nothing else. So if you're getting all that what I call white noise foolishness when you're trying to express yourself, then that person's motives might be off. And I would express that what you're doing right now is trying to gaslight me.
And can you explain to the audience exactly what that is, what that means?
So it's an issue can be not big, and it's like somebody's pouring gasoline on it and then making the focus be on them. I mean, that's very simplistic, but that's what it's like. That's why it's called that.
And my thing is, when it comes to someone telling you how they feel, that's how they feel. Exactly. And so you cannot tell someone else how they feel. If you don't agree, you know, that's kind of how I feel about it. If someone says, you made me feel this way, that's really how they feel.
And that's why we teach people to use that language, because if you step on my foot and I say, ouch, you can't look at me and say that didn't hurt. You can't do that. It wasn't your foot, it's my foot, and you stepped on it, and I responded the way that I responded. I do have the right to have that response. And getting in touch with who you are is very important. Knowing who you are is very important, because then you can explain yourself to other people. I say that if you explain yourself, you never have to make an excuse. So if you're a person who's more emotional, you can say that. you know what? I'm a little more sensitive than most people. So maybe you saying that to somebody else might not have affected them. But you saying that to
Right.
me, I have a very different response to that. You just explaining yourself. Then you don't have to make an excuse. I slapped you in the face because that's you making an that's you making an excuse.
Right.
But if you just explain in advance, that's fine. I think that will get you a lot farther. And we might not, because people are, oh, they supposed to know, they supposed to know. That's not real. That's not realistic. People don't know. People don't know. We have to teach people about us. That's part of that
Yeah.
engagement process.
Yeah. 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 And it's just, and sometimes, of course, I always say it's all in the delivery as well, of how you're telling someone. And you just tell them. And if I say, you can't tell me how you made me feel. That's, you cannot
Right.
tell me, just like I
Right.
can't tell you, that's like you saying something to someone and they saying you meant something different.
Mhm.
If I said it, then it's what I meant, not maybe how you took it. Maybe I didn't explain myself well. So that's kind of how I put that in that same area. But I know, Tara, are you starting to see like a lot of, like Promise brought up, with kids, not being in school and kids being home? Are you seeing a lot of kids, or at the same time, when they're young kids that have been out of school, what is your recommendation of how people should treat that? Because you do have younger kids, 12, 13, and younger, that are ending up with these now social anxieties because they've been home and now they're being put back, in the schools, or slowly put back in the schools, or some of them are back in the schools. And I'm sure kids are struggling. What would be your, advice for those parents if they're noticing those type of things, or what type of things should they look for?
If the kid continues to be withdrawn, and my answer, maybe because I'm a therapist, is take them to see somebody just to talk it out, But you're gonna see all that. And of course, I see a lot of kids because I do treatment for kids. But I think what's happening with the kids, you gotta understand, home traditionally is a safe space.
Mm-hmm.
So even though they miss their friends and all of that, they really deep down don't mind being at home. So now it's like, okay, go back. And it's the trade-off. Now I got to go back, see these teachers do this work, but I get to see my friends. So just like encouraging them into the positive parts of what they get from school, not what we want them to get, but what they get. Your social life, you get to go see your friends. Aren't you excited you get to go see your friends? Let's get excited about going to see your friends. Because I say this to people, school is not natural. That's why they have to legislate you to go. Don't no kid want to do that. Not even the best students. Think about it. Everybody look forward to spring break, summer vacation, Christmas break. Everybody. Because it's not a natural process to sit kids in class. That's not, nobody wants to do that. We don't want to do it. So it's just getting them back acclimated to doing that. And the kids that want to go to school, usually their home life is hell. I mean, that's really the reality.
Wow, that's deep. That is deep right there. And you know what though, but another thing though, someone was just talking about this the other day, how now with the the shooting in New York and in California, and people now being a little nervous about even going to the stores and stuff like that. I don't know if you've seen even myself, and I wasn't even at the grocery store when we had the shooting at the Lake Lansing Meijer. I wasn't even at the store, but that's
Wait, what? When did that happen?
What happened?
I didn't either.
so basically at the Lake Lansing Meijer, there was a phone call. Somebody called the police and told the police that a young Black man came in the store with a gun. He had a gun and he had a mask on. and the police came, and I'm not 100% sure on everything, so I'm just going by some stuff, but I'm gonna go by the video. What it appears is the young man, he did have a mask on, but he went and he checked out, he was scanning his little groceries out, and he went out, and the police must have caught him and started chasing him. So he ran, which would be normal for me for a young Black man, just being serious. And the police.
Well, you mean like a mask, like the masks that everybody's wearing? Like
no, he had
like
the mask. Yeah, he had the one you pull over his head, but he still only went in the grocery store and picked up groceries. They watched the tape and watched him go around the store. So he only went around the store and was picking up his groceries and then scanned out. He didn't do anything. And then when they went out the store, the police was chasing him, and they pulled out their guns and opened fire in the parking lot, with people in the parking lot screaming, begging them to stop, and some people getting on the ground. And then from what I'm hearing now, it was the wrong boy. He got shot though. He did get shot. He survived, but he did get shot. And I don't think he was the right person that they were looking for, and so when we have traumas like that happen, I couldn't even imagine being in the parking lot. Like, that's the Meijers that I would stop at on the way home. So I could not imagine stopping at that Meijers and walking out, and that people were out there with their kids, and you're chasing someone, and I'm talking chasing and shooting in between cars. I'm not talking like it was just some like stop, one officer shoots and then another one shot like maybe about 6 times or something, and in an open parking lot. And for that, like literally when I went to that grocery store, even though it can happen at any grocery store, because it was at that grocery store, I can tell you that I was looking around extra while I was there to make sure that I was paying attention to my surroundings and making sure that I was making it to the car. Like, that is traumatizing.
What you're describing is what we call hypervigilance, which that happens after a trauma takes place. Like, you get more like, it's more like I'm extra aware of what's happening.
Right. So when we think about what happened in New York, where someone purposely, it was New York, right? Purposely went to the area where people of color to start shooting people, like those type of things. I'm telling you, it just gives, I think even the people that's not there, it just makes you leery about even going to the store, because what if you have somebody that feels that passionate about driving close to the grocery store that you may go to? What kind of advice? Because I've heard people say, well, I don't even feel comfortable going to the grocery store, or I avoid that grocery store now, even though it can happen at any grocery store, but it's because it happened at that particular place.
But we have to normalize. It's almost like every time we get on a plane, we might worry that, okay, plane crash, but they're few and far between. And not to say that these things won't pick up, but we have to normalize that these are not normal. Because if we're on guard all the time, then it's like we expect these things are normal. So that's it. It's just the reflipping back to no, this, it may not be isolated, but it's still not a normal occurrence. This is not something that you really have to worry about every day. That doesn't mean that you don't take normal, regular safety precautions, of course, but you don't have to be so on guard that, you're not going to the grocery store, you're not this, you're not that, because then what we're doing is we're making behavior that should be normal pathological behavior. That makes sense. Like, we don't want to do that. Like, we definitely don't want to do that.
So what would you say? What would you say to the person or to the people that see, these things like in New York that Deandra was talking about? They see that, and the fact that they had it like on social media, you're able to see what literally happened. I don't even want to talk about the video, but I didn't watch it. I didn't want to watch it. I heard about it, and the fact that they showed it live and people saw that. And now there are people, like Deandra said, they're scared, literally scared to go to the store. I mean, the fear is real. And I mean, it is real, like that fear, with COVID, like people did not want to go to the store, that fear, it was intense and it is real. It's not something made up. I mean, people are dying. This is real. So what would you say to the person, or, to the people out there that do have such high anxiety about going to the stores, or because they have, what would you say? How can they get past that, or what would you have them do? I mean, I know see a therapist, but is there something?
But that's it, not to normalize that fear, because that is not normal. We don't want to normalize that. But also, if the anxiety is so great, until you can build up coping skills, there are things you can do. Order some Instacart. Ain't nothing wrong with that. Or whatever, however you do it, Amazon Fresh. We're not advertising nobody, but you know what I'm saying. Mm-hmm. Whatever you do that can help you, especially because we don't make everything a disorder. We don't do that. We don't disorder everything. So in order for someone to have certain diagnoses, they have to have these symptoms for quite a long period of time. So if someone has this high anxiety, for me to give them a diagnosis, it has to go on for at least 6 months. So it's just like, or if they're dealing with like an acute stress situation, that's less time. So we talk about the different things that they can do. I don't mind. I suggest that people see their doctors about medication. I am not a medication opponent. If you need it, get it. So those kinds of things. But if your functioning is impacted, is when we need to be looking at it. So if you never go anywhere, you're always in the house, you pull the drapes, you peeking out, then we need to have a talk. But
stop talking about me, Tara. Stop talking about me.
You're nervous because the grocery store that you frequent, people went there and died. That's a normal.
Yeah.
That's a normal reaction, but we don't continue to normalize it. We don't, and what I mean by that is, I don't continue to make you think it's okay to stay that way.
We would just like to invite you in on our podcast where we're going to talk about some things. So get your tissues ready. It's going to be deep, but it's going to be real. So we invite you to just sit in with us and share our experiences, share your experiences with us, and we'll share ours with you.